Good morning. Good morning on this beautiful Sunday morning in Berlin, and welcome to the World Health Summit. It's the first, or one of the first sessions of the conference that we have the pleasure to open this morning. My name is Elisabeth Schröder. I'm the head of program at the Global Solutions Initiative. And the Global Solutions Initiative is the host of today's session on innovative financing for global common goods, making the case for global health. We are a non-profit organization that was founded during the G20 presidency of Germany in 2017. Our goal is to support the T20 process of international think tanks that provide policy proposals to the G20. And we are here today to discuss innovative financing for global common goods, making the case for global health. It's been a year of important summits that have taken place, from the G20 summit to the new Financing Pact summit. Just now, I think the World Bank and IMF annual meetings took place. We are in the midst of a major reform of international financial institutions and a general debate on development finance. So we think it's very timely that we're here today to discuss this topic. But it's not me who's going to do that. It's those individuals there. And my task is only to introduce them to you. This is complicated with one mic and so many cards in my hand. I'm going to start with your session chair this morning, Christian Kastrop, here to my right. He's the managing partner of the Global Solutions Initiative. He's also a professor of public finance, fiscal rules, and international institutions at the Free University here in Berlin, and a fellow at the Hertie School for Public Policy. And in his former life, he was a state secretary for digital society and consumer policy at the German Federal Ministry of Justice and Consumer Protection until last year, before he came to join us. And he had many other roles at the OECD, the Bertelsmann Foundation, that I'm going to spare you because we want to get to the discussion. And he's humble. Next to Christian is Luciana Mendes Santos Servo. She's joining us from Brazil. She's the president of IPEA, the Institute of Applied Economic Research that is linked to the Brazilian Ministry of Planning and Budget. And in her capacity as president of IPEA, she is also one of the 3 chairs of Think 20 Brazil 2024. So, as previously mentioned in my intro, she is going to be chairing the T20 process that supports the G20 with policy proposals drafted by international think tanks. Next to Luciana is Esther Passaris from Kenya. She is the chapter chair for Eastern and Southern Africa at UNITE, Parliamentarians Network for Global Health. She is also a member of parliament at the Kenyan National Assembly, and she represents the capital, Nairobi County. She's also a member of the African Union's Pan-African Parliament since this year. Next one is Priya Basu. Good morning. I'm assuming that you're just coming from Marrakesh. Yes, because Priya is the executive head of the Pandemic Fund Secretariat at the World Bank Group. She has also been head of the Secretariat for the COVID-19 Task Force and leading the World Bank's engagement on pandemic prevention, preparedness, and response in global fora, including the G20 and the G7. And the last one, at least here present, is Markus Kosch. Welcome. He is head of oncology for Europe and Canada at Daiichi Sankyo, the Japanese pharmaceutical company. His previous roles in the industry include leadership roles at Pfizer and Wyeth Pharmaceutical. And he's also a medical professor and doctor who practiced at the University Hospital in Münster, where he also still teaches as associate professor. And we were hoping to have with us virtually, remotely this morning, Vera Songwe, the chairwoman of the board at the Liquidity and Sustainability Facility. Maybe she's going to join us later. No, I'm just getting a sign from our technical director that apparently she's not going to join us this morning. Very sorry to hear that. It would have been very interesting to have her perspective on our topics. But that means more speaking time for our other speakers, which I think is also very welcome. And with that, I'm done here, and I'm handing over to Christian to start off the discussion.
Yeah, thank you, Elisabeth, for this wonderful introduction. So I can really skip a lot of things here. That's great. Yeah, I'm very happy to have you all here this morning. And I think we have a very, very overarching topic, of course, and it's very well in line with the main topic here of this meeting here in Berlin. So a defining year for global health action. I think probably it really is if we also think about the last years. And having said this, I think this is also good, I think, for an introductory panel that, of course, health also here will be the main focus, and we are very happy about all these great guests who deal with this subject. But here, and this is what I would at least mention at the beginning, of course, there would be also the possibility for the panelists to enlarge a bit. So, of course, health is also one part about, say, global common goods. It's a very important issue of global common goods, but it is also related to other global common goods, which also have to be dealt with if we really want to go for global health or for better global health. And therefore, I would encourage all my panelists here in this small round, also where they think it's useful to enlarge a bit, go to the broader perspective in which the health issue is embedded. So this is, I think, the possibility for this panel, and you can use it or you can't, but I'm happy, whatever you do. So let's start immediately with the question from my side, and I would like to have a little bit of I would call it a bit of an icebreaker, because I would be very interested in the first instance what you are really most concerned about. So, and I think this could be a personal perspective on that topic. You can do it, say, health, but you can do it broader if you wish. So I would choose one of them. So you could have a personal perspective, an experience on the ground, or what is your most emotional issue right now linked to that topic. And I would start with Esther in that case.
Thank you. Okay, as a parliamentarian in Kenya serving my second term, Kenya is a low middle income country, and we have a lot of poor people. So every other message that I get on my phone, because somehow our numbers go viral. I don't think parliamentarians in the UK or the US have their constituents calling them or texting them and asking them for support as much as we do in Africa. So once they've got your number, you have to answer their messages. I've got over 40,000 contacts on my phone, and no matter how much space I buy, I'm still always challenged. So I'll receive a message telling me my husband, in fact, I've got a patient right now in the referral hospital. The husband had worked for a very, very big private company for many years, but he retired this year early. His medical cover runs up to December with $1,000 cover. And he had the medical card for Kenya, which is the National Hospital Insurance Fund, which goes for about $50 or so a year. So here is this woman calling me and telling me, my husband is being detained at the hospital. They will not release him. Now, we have legislation that says we should not detain anybody if somebody's died or any person who has been already treated. But the thing is, we always end up having to write to the referral hospitals. Now, I feel a bit challenged sometimes when I call the referral hospital and I say, please release this patient, because the referral hospital also needs to have money, and the government has not yet cleared all the waivers that we politicians go and ask for. So when I look at this young lady, this lady with her daughter, both of them have been texting me. Can you imagine the husband was released to go home, and he's in his 70s, released to go home probably a month and a half ago, and he's still in hospital. I've spoken to the PS, I've spoken to the CEO of the referral hospital, and that's just one case. There are many, many cases where people don't have the medical insurance, and they rush to get the medical insurance when there's the 3 months period. So when we talk about universal health care, which started as a buzzword from 2013, those families that don't have access to any insurance, when they go to hospital, they cannot find the treatment they want. I have another case of a lady whose daughter became blind, and she's only 10 years old. And the reason she became blind, she started having headaches. The mother went from one institution to another institution, and she's looking for solutions. But by the time she was told, go and get an MRI at this private hospital by Lions, the MRI was 35,000, which is Kenya shillings, which is about probably $300 or $400. And she didn't have that, so it took a lot of time. And before you know it, the little girl is now blind. So when you look at innovative financing, I think it has to understand the population that you're serving. And you have to understand majority of the people that I serve are not on any medical insurance. And when they end up in hospital, they just want their loved ones treated. And they want to be able to get the best possible care. And the knowledge of where to go, who to see, not to tarmac across the entire country, not knowing where to go. So I think we're not using our social media properly in terms of informing people. Our civic education is not there. So people, it's one thing to provide the service, to get the funds to provide the service, but it's quite another to convince people the importance of medical insurance, and also to let them know where to go when they're challenged with matters health.
Thank you, Esther, for that case study, and I think that's a good starter. Thanks a lot. Priya?
So you asked what I'm most passionate about at the moment, and I think it is to really get the world better prepared for the next pandemic. We live in a world where climate change, deforestation, changes in biodiversity, changes in land use pattern, water shortages, all of these are only exacerbating the risk of the next pandemic. And if you talk to the WHO, they'll tell us it's not a question of if, it's a question of when the next pandemic will hit us. And I was just looking at a study the other day produced by Affinity that says there's a 47 to 57% chance of another COVID-like pandemic hitting us in the next 25 years. So the question is, we're now coming out of the last pandemic. We've learned a lot of lessons. One big lesson is that we were chronically underprepared for a pandemic of that scale. We allowed a little virus to get by without being detected and contained, and the havoc it caused in the world. The trillions of dollars that the global economy has lost because of that pandemic, because we were not able to contain it, not to mention the millions of lives lost. And when you look at the cost of investing to get low and middle income countries prepared for the next pandemic, to get to the level of preparedness, the estimates that we've produced, the World Bank and the WHO has jointly produced some estimates that show it takes about $30 million per year over the next, $30 billion per year over the next 5 years. So $150 billion over the next 5 years to get low and middle income countries prepared for the next pandemic. Just compare that with the trillions of dollars we lose if we're not prepared. So to me, investing in pandemic preparedness is a quintessential global public good. And it is linked with other global public goods, such as investments in climate change, and both adaptation and mitigation. And I think these things have to be seen together. And, any dollar invested anywhere in pandemic prevention or preparedness benefits everyone, everywhere. So that's the classic definition of a global common. And really, there is a tremendous urgency to make those investments now, so that we protect future generations.
Yeah. No, thank you very much. So we will indeed enlarge, especially on your latter subject, a little bit more also in the next round. Marcus, what's your best guest to my question.
Yeah, you asked what I'm most passionate or concerned about right now. I think, to be honest, that hasn't changed over the last 30 years. When I started studying medicine or working as a doctor, it was actually the intent to bridge science innovation into improved treatment standards, improving patient care and making a difference for patients. And that then in the industry was the same. I just learned, working in Africa and Asia, mostly in Europe, that it is more complex than just a better drug or a better surgery or even prevention. It is the interconnectivity of health and you mentioned climate change, a good example, right? The WHO believes climate change is the biggest risk to global health actually right now. We have 30 million refugees because of climate change reasons, and that is, everything is interconnected. And so our solutions need to be holistic, need to be looking at those integrated solutions, especially when funds are sparse and we need to focus. And I'm not sure we are good enough in that. The pandemic is in a way a good example. I think that was a very concerted action. The industry and science delivered a vaccine in record time. Regulators have been asked like acting fast. The governments built the infrastructure. Healthcare professionals vaccinated. So that was, I think, a relatively good example of what can be done. I'm not saying we are prepared for the next one and we can't do better, but in a way it shows how interrelated health, certainly a pandemic, is to any aspects. And again, I'm not sure we are good enough yet. We have this holistic picture, really. If you look at the Sustainable Development Goals that the UN has set, there was huge progress, I think, for 10, 15 years, up to 2015, 2019. And there's more or less a standstill that if you look at the indexes, I don't think we have continued the momentum in focusing on health in a holistic way. And I wish that giving the other priorities in politics in the world right now, and that's very obvious just in the last couple of weeks and days, we still need to maintain the focus on health, because that's the basis for economic welfare. It's the basic for societal development and making sure we advocate for health being one of the key, if not the most important global development goal.
Thank you so much, Marcus. I really think so. Holistic approaches are missing, but we come to that again. Luciana, so you have, what's your pitch?
It's being the last in the panel is always great because you can add a lot to the debate, but not that much. And I'll start with what Esther said about poverty, inequities, and inequalities in access to healthcare, in access to basic services. This is my main concern. I work in the health policies and research for 20 years. And one of the main concerns is when you get to the pandemics, what we reveal is what we health specialists know. We have a lot of inequities and inequalities in access in our country and between countries. In Brazil, we've seen a lot of difference in the results indicators between the black population and the white population. There are 3 times higher deaths between the blacks than the white ones. There are also higher maternity mortality rates for the black women, 2 times higher than the white ones. So we have seen this, but we are really grateful that we have a unified health system, a national health system to try to provide universal health care. During the pandemic, this system showed its force for the population, and now all the population in Brazil is saying and defending this unified health system, because we've seen that if you have not unified health system, the catastrophic health expenditure will be explosive. And we know in terms of our equity in financing that we don't have some kind of universal coverage. What we've seen is huge inequality in access. And besides that, we also have seen that coordination and a holistic approach is fundamental. If you don't coordinate the health sector with other sectors, with climate change, with other educational sectors, with digital health, the problem is that we have a sectorial view and will not bring a whole response for the problem. And for sure, what the pandemic showed, that we're not prepared. We're not prepared as a world, we're not prepared as a collective society, when you have to prepare for this. And to bring this coordination and this integration as a global response is fundamental. And although health is central for this, health is a part of all what we are calling One Health. It's looking for the health, human health, the animal health, and the planet health. You have to integrate the view about health to give a greater and better response for all our problems.
So thank you very much, Luciana. So it looks like we have now Vera on the... Can you hear me, Vera? Do you have a... Can you try to say something? Or so you can you hear me or not yet? Okay, so maybe the technical team will try its very best.
I cannot hear you now.
Ah, okay, okay. So
I cannot hear.
okay.
Hello.
Okay, okay.
Hello.
So the technical team should give me a hint. Otherwise, I just move
I cannot hear.
on, and then Vera can come in later, I guess. So maybe we mute her for a minute, and then you can check. Okay, so we hope we get her. No, thank you very much. So you already mentioned a lot of, say...
I cannot hear you guys at all.
We hear you very well, but you can't hear me, so that's the problem.
So we are also not prepared yet for full virtual communication. That was the proof.
Yeah. Can you hear something now? Okay, Vera. So then,
No, we can't
But
hear
now we
her.
can
so we have a one-way road here, but okay, you can hear us now. So then I will not make too much of a ado now.
Sorry, I have 4 screens on. I don't want to interrupt. Why don't you go ahead if you cannot hear me?
No, now we can hear you. Can you hear us?
I don't think they can hear me anymore.
No, we can.
So we just observe a very important global common good, and this is communication, which has not really it's not really an issue for global health, but a good communication. I guess it's part of your holistic view. A lot of people mentioned here it's holistic, and so communication is probably the most important one we miss out here. So Vera, we can try it again. In a way, we already met because I've seen you at the Berlin Global Dialogue some weeks ago or some days ago, but there was no chance to meet. But we are just here asking the people in the first round what is their, say, very quick takeaway. It was a bit of a longer quick takeaways here already, but what would be your most important thing, or what concerns you the most right now? I guess you have also been in Marrakesh, or I'm sure, maybe, yeah. And maybe what is your snapshot perspective or your biggest point?
Thank you, and thank you. I guess my biggest achievement is to make the whole hall laugh. So that's what wakes everybody up. Listen, I think, we have gone through the COVID pandemic and we have seen the devastation that it has given for both lives and livelihoods. And as we go forward, my sense is that the most important thing today is to really stand up the pandemic preparedness instruments, because we know that certainly we will go through another crisis again. The question is when, and we want to make sure that when that happens again, we are not in the kind of gloom and doom scenario that we were in before. And secondly, that will also mean, working better with the global commons. How can we make sure that when that happens, we consider it a pure public good, that everybody has access to all the prophylaxis that we need, the information that is needed, so that countries can then take actions that they require. I think what we have seen is that when, there is a rise in nationalism in front of a pandemic, the world hurts more and the world hurts for longer. So it's really 3 things. It's stand up the pandemic preparedness, put the resources behind it that are needed, but also more importantly, make sure that the knowledge around how to deal with it is more democratized and people have access to both the knowledge and the instruments that are needed to make sure that the impact on our lives and livelihoods is not as acute.
Yeah, thank you very much, Vera. So now I guess we have a line of communication. That's very good. And thanks also to the technique on the side here. So we've done it finally. Yeah, so I think it's already a nice vintage what you gave us. And at least I want to stay a little bit on that issue. And I think we could also be in a more, we can now be more on talkative mode. So I would also accept, so somebody would say, hey, come on, I would like to say something to that. And but I would still like to see, we have already started a bit to identify the main issues. And I would now maybe start with you now, Luciana. So if we think about the main gaps and so what would you really think? So I think the last round, I think, will be what are our solutions. But I would still leave a bit of a time maybe to go now into more depth of what is probably wrong. So you all alluded already to some of those issues, but I would think that we can really identify the core of the problems. So if we have one round about that, I would rather like that, and then maybe we can also have a kind of a discussion about that before then finally we would turn to what would be your most important solutions. But can we try to identify the main gaps again or a bit deeper?
Okay. As I'm saying, we have a unified health system, a national health system in Brazil, and it's based in rebuilding a model based in primary health care. So we build a family health model in Brazil, which is quite advanced. But in spite of it doing this, to have a family health model, what we've seen as the financing model in Brazil is still in high specialized care. 45% of our financing investment are in high specialized care, are not organized and coordinated with healthcare and primary healthcare. And besides that, we have a lot of spending in medicines and other diagnoses, but not coordinated with the whole healthcare sector. We've seen during the pandemics and previously that the primary healthcare, a strong primary healthcare, will help us to coordinate with other action. For example, in Brazil, we have the health workers, the community health workers, working together with the social assistant workers, working together with the other agents of pandemic agents, working together with the traditional communities and a community-based access to health that could coordinate the response barrier. But the problem is that even if we have a strong primary health care, we also need to have a comprehensive health system. And this requires money and public money and tax system money. It cannot be based on out-of-pocket money. Although we have this national health system, less than half our financing is coming from public funding. And this is the problem, because even though the system is built to be a national system, and this could be an example for the countries, what we've seen is that the idea of out-of-pocket is organized in the system. The idea of new technology is organized in the system. And the idea of building a consumption that is not coordinated is organized in the system. And besides that, when you're looking for the traditional medicine, other things that could, doing a lot of debate about ecological system, we don't have seen this in Brazil yet. We need to do a more coordination between this ecological system, this national system, and the financing of this national system for Brazil, and not only for Brazil. The health system, family health system in Brazil is being used as a model for other systems, but it has to be integrated and more coordinated with other health sectors and other sectors in Brazil.
No, thank you very much, Luciana. Marcus, over to you. So
I think
identify the big gaps.
Yeah, Luciana said it very well, and it's a little bit referring to what I said initially. I think one gap is that we still look at specific health issues in a too isolated way, that we don't see the interrelations, connections enough. And you call it coordination, and that is, I think, really what's needed also to make sure we're not exporting first world health solutions to areas where for structural reasons they can't work. Obviously, and I'm not jumping into solutions, but we come to that later, I understand. But Daiichi clearly is focusing on what we are best at, which is medical innovation, developing new medicines, new approaches, and in trying to do so and bridging that to as many patients as possible, we see the gaps or the hurdles in, it can be international trade barriers that make it more difficult, it is lacking infrastructure, it is also often the lacking priority for health issues in local and also global policies. So I think that we need to, as a community, change, making this really a priority and approaching it in a, as we said, holistic, coordinated, integrated way. And that is still, I think we are not yet there where we should be. And we need to reinforce the dynamic in really making health a core value and approaching it together.
Yeah, and we will come to that then a little bit later on how exactly to do that. But I'm very happy about both your interventions, and I would go ahead with Priya.
Sure. So just to build on what Luciana and Marcus have already said, I mean, I think when I think about the gaps, there's the financing gap. So that's kind of a big one, and that's financing. Again, staying with my topic of pandemic prevention and preparedness and response capacity during peacetime, so that the world is better prepared for the next pandemic. There are financing gaps at the country, regional, and global levels. It's the global south that needs that needs support in bridging those gaps. And as I started to mention in my earlier remarks, we've estimated that the world needs about $30 billion per year over the next 5 years, $150 billion to get the low and middle income countries prepared for the next pandemic. Per our estimates, about 2/3 of that needs to come from the countries themselves through domestic resource mobilization. So what can we do to incentivize countries to invest more in pandemic prevention and preparedness? And about 1/3 needs to come from the international community, so about $10 billion per year in external financing. And you think about it, these numbers are tiny in comparison to the cost of not investing. So there's the financing gap, and then secondly, as again mentioned, lack of coordination, gaps in coordination, collaboration, and here I talk about two types of gaps. One is the need for better coordination amongst development actors, development partners, and Luciana, as you were mentioning, the global health financing architecture is really very siloed, very fragmented. Disease-specific interventions, all of which results in the whole being smaller than the sum of its parts, unfortunately. So what can we do to get better collaboration among international actors? But then there's also at the national level, as well as at the regional and global levels, there's a need for multisectoral approaches, as you began to mention. One Health. This is not going to be solved through different ministries acting in isolation. Health, environment, animal husbandry, agriculture, they all need to work together. Yeah. So that's kind of, so again, the financing gaps and then gaps in coordination.
Yeah. So I think, this will be, and then indeed in the last round, we will go exactly to that, and then to see what can we really do except just money, but sometimes it's just money, I know it. Esther.
Okay, so when I look at Kenya, in 2010 we ushered in a new constitution, and that led to 47 new counties, or more or less like the states, different states. So the 47 counties, we devolved health, except for the referral hospitals. Now, we noticed that by devolving health, we created a problem in that before the executive had a good training program, a good a system of promotions and motivation of the staff that work in the medical field. And when you devolved it, there was a bit of a crisis there. So we're talking about whether we should take over some functions, especially the human resource, because without the human resource, you can't really do much in terms of UHC. But then when you look at innovative financial mechanisms, I think we have to look at the best practices. Right, the Debt for Health, which was done in Cote d'Ivoire, was a very good project, and I don't know why we're not replicating it. Most of Africa is crippled in its ability to get funding and actually use those funds in areas that are really needy, and health being one of them. Why is that? Because we basically are struggling to pay debt at interest rates that are really double what the Global North pays. So if we could take the Côte d'Ivoire Debt for Health project and say, did this work? The debt, we're going to write off this debt, but we're going to put it into health, at least 50% of it into health, the rest of it going into the international organizations like Gavi and UNITED that deal with health. So I looked at Kenya, and the capital city of Nairobi didn't have enough facilities. The county government, though devolved, was not able to put up the facilities. So the government created a new entity out of its frustrations because the people were complaining that health is not near to us. And they put some extra funding and created about 20 new hospitals in Nairobi. We also came up with a very ambitious project of medical equipment supplies, where we put over $450 million in medical equipment supplies across the country. Now, all these interventions that we're trying to do, we rush into them because of the pressure from the ground. And of course, there are challenges. So I feel that if we could do what the NGO world recently did in Nairobi, they showcased in an international film festival all the best practices that are happening in the NGO world that are working in different parts of the world. And I feel that in the medical sector, there's a lot of innovative financial mechanisms that are working. And we need to borrow from them and be able to implement that to the ground so that the grassroots can feel it. So it's basically looking for more and more solutions to raise taxes. I mean, I think if anyone in Kenya were watching this and saying, oh no, you can't talk about raising taxes, we're already overtaxed. But I look at some of the best countries in the Scandinavian countries. Some of the taxes go as high as 50, 60%. If people are taxed and then they see the service, then they start realizing that actually we're having a huge saving and we're able to get on with our lives even with the less amount that's in our pockets. So I feel that health will require innovative financing that actually targets providing universal health care, providing preparedness for the next pandemic, providing training for the staffing, the medical staff that you have, providing education. People talk about, countries like Australia, the UK are looking for nurses and doctors from Africa. We've got a lot of unemployed people, but then the challenge again becomes, are they speaking English in the right manner? Do they have the right training? So I feel we need a global holistic approach when we come to innovative financing and having it targeted for health, and then looking at your own populace and thinking, are we really winning? Because, when you look at the pandemic, a lot of people feel that we live in a pandemic every single day when we're dealing with our health issues, whether it's cancer, whether it's diabetes, we're not able to sustain ourselves. So we need a global approach and global solutions where we learn from each other. And I think the global north has got to start being a big brother, big sister to the global south, because really debt is crippling us. So no matter what innovative mechanisms we come up with, we will always have Big Brother there to collect the debt. So the Debt for Health project that came in Côte d'Ivoire should be replicated across the globe and help the developing countries that are not able to sustain themselves in matters health to be able to divert that money that goes into paying ridiculous high interest rates that developing countries are subjected to because their risk is higher and they're not able to provide services in any other area.
Okay, thank you very much. So, I think it's very important because you also are in close touch with the whole civil society, and you work a lot in parliaments and on the ground in Nairobi. So I value that really very high. So thanks a lot for that broad picture. And we'll for sure come back to that in the last round when we try to, bring all the things, bits and pieces a little bit together, what really is needed. So Vera, I gave you some time because you were a bit of the latecomer. So we are right now here in the round about what are, the main problems, the main issues, the main gaps. But of course, we already have touched into the issue of what would be needed, what are the most important points. But this will be then mainly in the last round, so when we can try to get even a bit broader on that issue. But again, of course, everybody already has alluded to it. And so, of course, you also have the chance in the finals to be very explicit about specific finance or other issues which might help. But I would also ask you first in that round, what would be your identified most important gaps right now? So what would be your takeaway?
Let me maybe just quote Tedros, the head of the WHO, who said that potentially the most important health agreement that happened in the last century is the Paris Agreement. And I think what he was trying to do was put the importance and the evidence of how important the climate emergency is to our health and the fact that they are intrinsically interconnected. And I think that we must look at it. There is a lot of challenge and tension today when we talk about poverty reduction, prosperity, and climate, and people say, oh, but they are trade-offs, and we must pick which one we do because it's important. In some cases, there will be trade-offs. But I think what is clear is that, when you have 29 million women dying because of poor cooking facilities, breathing the wrong fossil fuels or putting down the wrong fossil fuels into their systems, that's a health crisis, and we need to be able to address that. And so I think the discussion of the health challenges combined with the discussion on climate change is a particularly important aspect that we must look at and see. I was just in New York at Hunger Week for the Earthshot Prize, and it's interesting to see that a lot of the solutions for keeping our environment clean and green and making sure that we don't hit the planetary boundaries are also solutions that by definition improve our health and our well-being. When you think about, less commuting and less driving, it's just less stresses on the women and the mothers. When you think about better cooking stoves, when you think about improved and cleaner water. So I think that to make sure, and I think it was Priya who said it, hi Priya, making sure that there is a interconnectedness and a collaboration between our different fields of work, so that we're not just talking, okay, well, this morning we're just going to talk about health, and then tomorrow we'll talk about something else. It's particularly important. And the other thing, of course, when one starts looking at these things is how we measure it, right? Today, we know that, the number of beds, for example, in the developing world, hospital beds compared to the number in the developed world is almost 100 times more. So the multiplier is so high that that there is a gap in this area and we need to fill it. And I think that if we started measuring better, what were the challenges and putting that out in the public domain, we will probably get to a place that is a much more healthy place for all. I was privileged with Mariana Mazzucato and a group of 10 other women to do this report called Health for All, where we say that good health is, good for the economy, is good for prosperity. And so we actually start looking at a healthy planet as the sort of beginning of everything else that is needed. And I think in doing this work, we realize that, some of the things that we do in silos actually hurt us more than they help, even when they are good things. And I hope that part of these conversations today is really about how we bring together, the different strands of life to be able to solve this problem in a much more comprehensive way.
No, thank you very much, Vera, for that insight. And of course, I guess this is one of the big topics of this World Health Summit. And I think we will see this in a lot of other panels here today and the next days. And so I'm really happy about this great crowd here so far. And maybe this can be also a pitch for some other panels here. So thanks a lot. So I think we once in a while finished, I guess, this part, and I would just like to highlight some of the issues which have already been mentioned. So of course we have already tackled the finance issue. It's an issue about money, but it's not just an issue about money. It's also about issue of fragmentation, and fragmentation, of course, is an issue which we have here on a global level right now. There is a bit of a fragmentation. Global governance, and some of you also alluded to that. Global governance, of course, is a bit in turmoil. It's a bit more problematic. There are a lot of conflicts, and I think maybe we have really seen that somehow the after-war, Second World War global order is a bit on the retreat, and I think it's on the retreat for some good, because we really, I think, have to include the Global South fully into that global government. But of course, it will need change, and you see, to bring change along and to bring it along really that everybody agrees. This is another very important issue which will take time, and this is also what you mentioned here. We don't have that time, and so we have so many pressing problems, and this is what we just seen. So it's siloed, it's too isolated, it's about money, it's about lacking resources, and then it's about empowering of civil society too. So I think we have a multiple problem, and I think we see how we can help here. And so I would immediately move forward then away from our issues, and I think the issues have been identified rather well. But what can we now take away? Maybe let's start to endeavor a bit what is really needed. And of course, there are several issues. Finance is, of course, one issue which is rather close to my heart. Financing global commons is an issue there, but I would again try to ask you to be as specific as possible if we come to the big solution. So what is it? I see finance will be in the center of that. You've mentioned it, but I would rather like your big picture about what do we really need now. And I would start with Luciana.
Okay. Well, first of all, we have a lot of initiatives in terms of new mechanisms, new instruments of financing. One of them is all the bonds that we are putting on the market for the green bonds, health bonds, social bonds. And for me, first of all, we need to coordinate these instruments. If you have sectorial bonds, maybe they will have a sectorial view. Mm-hmm. So coordinating the green bonds with the health bonds and having a more integrated view is important. And also, when we talk about bonds, we are talking about long term. So you have to have care with the kind of incentives that we're creating when creating these long-term problems with the bonds, because we want the problems to reduce. So the bonds has to be managed in some way that we go to the reduction of debts, reduction of the problem that the bonds are created for. Mm. Besides that, when we're talking about inequalities, in the G20 presidents, our Minister of Finance said that we have to think again and strongly about a more progressive tax system. This is central. It's not easy. A lot of countries have talked about taxing wealth and other instruments for a more progressive tax system. But in fact, what we have seen is an increase in inequalities, and increase in inequalities led in some sense also by an indirect tax system, a regressive tax system. So you cannot think this locally. This is a global problem. Bringing this to the G20 is fundamental, because we need to do this in a coordinated way. We know that the main problem to have a progressive tax system is that the companies who are being more taxed go to other countries and do tax evasion and other things. So coordination is essential for this. And besides that, we need transparency. The transparency team has already been talked here about how we manage to do all this intelligence, this artificial intelligence, the big data intelligence, and all the progress that they have made to bring more transparency and more information to the society, to know how the investments are going to, how effective they are, and so that they can know that the taxes are being applied correctly, also the spending is being applied correctly. We have a lot of experience in Brazil with community health data that bridges the gaps between the big data and the local data. Mm-hmm. So having community data together with national data, international data is essential for us to know more about the reality, the local reality and the international reality. So I think these are the ways.
No, thank you very much for that Brazilian perspective, and I hope you will just do it. Yeah, so then let's look to the global part a bit, and this is of course I would then go to Vera maybe first, and then Priya. So Marrakesh, what is the takeaway? So how do you see it, say, on this more global level? What is really missing? Can we optimize the existing systems we have, or do we really need new systems? Do we need not just sort out complex system, but do we need a new system? So this would be the questions I would give to Vera, and then to Priya, and then go further along. Vera, would you like to start?
Yes, please. Why not? No, thank you very much. I think we have to start by, first of all, agreeing that the cost of inaction is a lot more expensive. Sorry, the cost of action is a lot more expensive than the cost of inaction. And once we agree that, you know, we need to do something, hopefully there is movement in that direction. One of the things that we were looking at, I was part of the independent expert group for the G20 finance ministers on a report on MDB reform, which was why I was in Marrakesh presenting that report. In that report, we talk about the need, one, for the multilateral development systems to work even better together. And I think part of that starts with recognizing that WHO is one of that family, and that it needs the kind of funding that it needs. One, to tell us, right, prevention is much more effective than cure. If WHO had the right alert systems, and as was just said, you know, we have enough information with AI. We know when the next problem will start, but we then need the resources to be able to ensure then that those conversations are happening at the right time. We are asking in these reports, of course, for an increase in a global capital for these institutions. If you think about it, the resources that have been going to the IDA, the World's Poorest Countries Fund, have not increased in the last 12 years. The shareholders have not increased those resources. So yes, while I love, actually they have reduced by 25% in real terms. So it's very good for us to sit here and talk about, you know, the need for health for all and health as a global public good. But if collectively we are not funding it as such, then I don't think that, you know, we are actually consistent with our own dialogue. And I think it's particularly important that as we go to markets and as we raise market resources, we must agree that health is a global fundamental public good and will require public resources to deal with it. And in that case, public resources are the cheapest, the most long-term capital that is needed. And it is the global multilateral development institutions that can provide this kind of concessional resources, which is why we need that. Yes, in partnership with the private sector that will do the pharmaceuticals, that will provide the services that are needed for healthcare. But at the core of it is public capital, concessional long-term capital, to make sure that we begin to deal with these issues. And I think that's what we're really hoping, that, you know, the big shareholders of the multilateral development systems can respond to, fund the WHO well, fund all the MDB system appropriately. The funding will go nowhere if we do not have government and national leadership. We need national leadership, we need national ownership, we need a recognition at the national level that health is an important economic investment, not a social good, but an economic investment. And so resources must go. Today we are all talking, as you talk about bonds, there is a statistic that says that, you know, 27% of the low-income countries are spending a lot more resources paying back interest on debt than they are spending on healthcare. We do not want to continue this statistic, so we need cheaper resources, and we need to make sure that they're done. Healthcare is actually addressed as a global public good with concessional financing.
No, thank you very much, Vera. I think this is also giving us the insights a bit from Marrakesh and from your work around that. I would even sharpen it a bit if I am allowed to, Priya. So I think what we discussed here so far, a little bit, is a bit too little, too late, too slow. Of course, we have a very complex, you know it from the World Bank Group, a very complex finance system. A lot of actors have an interplay. They may all be needed, but for an outsider, I've been at the World Bank and I've been at the IMF, and was familiar with the principal issues, but the whole complexity of the system always stuck me. And of course, as you know, whenever we go into new finance for the Global South and for global common goods, it's always the issue. It's arbitrary. You need political decisions from stakeholders of the institutions. So do we need a thorough reform of that, or do we even need a new, say, system on top which is less arbitrary and less politically driven? Or I will not push you, but maybe you can offer some views.
Look, I'm also just coming from Marrakesh, and what I can share with you is that, there's really a lot of energy around, MDB reform process. The World Bank is committed to both a better and a bigger bank. There's a recognition here that better means more efficiency. It means doing things, smartly. But even if we do all of that, we do need more resources, and we need more resources both from our shareholders, but we also need to think about innovative ways to tap the private sector. We need better partnerships across the MDBs as well, and there are things that we can do already. We've started to work, alongside our other sister MDBs to think about, for example, new co-financing platforms and so on. So, what I can share is that action has been galvanized, and already there are many kind of innovative ideas and streams of work underway to support these global commons that we're talking about. If you allow me, I just want to briefly touch upon one of the solutions that came out of COVID last year, the Pandemic Fund, which I lead, which was really a recognition again that although there were many institutions that were focusing in one way or the other on pandemic preparedness, there wasn't a dedicated stream of international financing for this area during interpandemic periods. And so, from SARS to MERS to Ebola to Zika to, each time, there was a state of panic, and then people came in. But then when the pandemic was over, we fell into a cycle of neglect. And then we were faced with COVID, and look how unprepared we were. So the Pandemic Fund is one part of the solution. We don't do any direct investments. We work with other MDBs. We work with the WHO, with UNICEF, FAO, Global Fund, Gavi, CEPI. Our goal is to bring all of these actors together around country needs, around national action plans for health security, around global plans for health security, around regional plans, to make sure that investments are properly coordinated, and also to make sure that there's intersectoral coordination. And just in terms of concrete areas, what we are trying to focus on is surveillance, early warning, data sharing, community engagement, community health workforce, other health workers, surge capacity for all of this, and then medical countermeasures. So that, these are the kind of the key areas where we've identified gaps in investment, and those are the gaps we're trying to fill.
No, thank you very much. Esther, turning to you. So you are, probably very close to civil society, but you're also very close to the situation about the Global South, Africa especially, but also I know a lot of other countries. So what do you think about, say, the most important issues? Is it finance? And then I would ask you, what would be your pitch for finance? Or are there other issues of the same importance, of course, which would also be very welcome? And then I will ask Markus the same question. But Esther, you first.
I want to share with you a success story on innovative finance mechanisms. The advanced market commitments for vaccines. They managed, by getting commitments from all the donors, to reduce the price of vaccines from $60 to $3.50. And if you look at UNITAID, the tax levy on travel, €1 for an economy class ticket, €10 for business class, and for international travel, I think it was €4 for economy and $40 for 40 euros for first class. They managed to raise 1.2 billion in United managed to raise 1.2 billion in the first 6 years. It's been implemented in France, Chile, Mauritius, Korea, and I'm just thinking if we can call out the countries that don't commit to this tax, which can help really steer the world. I mean, can you imagine a vaccine costing $3.50 as opposed to $60, right? So, and when you think about it, all of you have traveled probably business class, economy class, coming here. Really, would $1 extra on your ticket or of $10 have made a big dent into your pockets? So this is the Robin Hood tax that we need to introduce. The Robin Hood tax, even to your organizations. I mean, really, it wouldn't have, but it would have had such a big impact on the world. And we have to be each other's keeper. When you looked at the pandemic, it was global. You could not care about Africa or be indifferent, because at the end of the day, it was traveling by air. It was coming to every region, all right? And the same thing we've seen with Ebola. It could go anywhere. So the next big pandemic could affect you. So if you can't care for us because we're the global south, care for us because we could, if we sneeze, you'd get a cold, all right? So, for me, I feel that really humanity is at its biggest test right now, you know? And now that I have this platform, I mean, I know we've all talked about what's going on in the Middle East right now with Israel and Palestine.
Yes.
I mean, we're all here for global health, and we're all here for innovative financing. And we cannot ignore the fact that innocent children and people are dying, all right? And for me, I feel that while we sit here, we have to take cognizance of the facts that Palestine needs us to speak out. Why? Because not every citizen of Palestine is Hamas. Those little innocent kids require help, require aid, require support. I think there is a big challenge in the world today where we sit in boardrooms and we sit in conference rooms, and then we disconnect from the very thing that's connected us to come and have a conversation. As a mother, I can't imagine what is going to happen to the World Health Order when we start now trying to pick up the pieces, right? Two wrongs don't make a right. We really need to figure out how, if we're going to have global health, who do we isolate? Just because there's a war somewhere, do they not need health? Do they not need help? Do they not need our finances? So I feel that the children of Palestine, the women, the old, that are trying to get away and are being bombed as they get away, really need us to be honest and sincere. So what are we talking about? When we look at climate change, I saw our president go and sit with Macron and say, come on, enough is enough. For the last 20 years, you've been promising us funding for climate change. Most of that funding should be directed towards health. And they say, oh, we can't find a mechanism to do it. We've made promises. Can you imagine if the Global North makes promises and they don't fulfill them? How in heaven's name do you expect the Global South to fulfill any promise it makes? Because we learn from you. So as role models to the world order, I think it's important that people put their money where their mouth is. They have to give the funding that is required in the Global South on climate change, and that's where we start. Because if we're talking about innovative financing, the poor can't raise money for themselves. And most of the poverty that we're going through right now in Africa and the climate change challenges that we're having, especially in matters health and gender, are caused by the fact that the emissions are in the global north. So with less than 4% emissions in Africa, can you imagine what the impact would be if the money was released and let's say 20-30% was dedicated to health? We would not have problems. The monies that we're spending or failing to spend on health are caused by the fact that we are servicing debt at a higher interest rate than you loan yourselves money. So I think today I would like to say, even though my president and quite a number of people in my own country have stood with Israel, I would like to say that we need to stand with Palestine. We need to stand with the children, the women, because not all of them are terrorists. They're just human beings like you and I. They could be your child, my child. So the world order requires that humanity holds together, because if humanity fails, we all fail. Thank you.
No. Thank you so much. Marcus?
That's tough now.
Yeah, I know. that is why.
Adding to what Esther said, but I try, and thanks for saying this. I agree with everything you said and also Priya said, but want to come back to the question, and Christian, you asked to be very specific on how potential solution could look like, or what could be approaches to actually increase what everybody said, more funding, more resources, both from the private and from the public space, directed in a coordinated way on the priorities that actually we believe are paramount. And I believe one very powerful tool could be more private-public partnerships. And I know Esther will agree. I don't know whether everybody knows this. She was a pioneer in Kenya, in Nairobi, funding some very successful private-public partnerships. Also in the health area, I believe this could be a very, very smart tool if done right to overcome the wrong allocation on topics that the market obviously makes look attractive, while at the other side still unleashing the capacities of industry, of private sectors, the capabilities and skills, and co-sharing the risk of forward investment. A good example, and there is good examples of this already working well, is for instance the AMR initiative, like antimicrobial resistance initiative that GHI is co-funding together with the Bill and Melinda Gates Foundation and the Global Investment Bank, which actually is aiming to build funds directed at the development of antimicrobials to overcome resistance, which is something that the market will never actually sort out. And you need to redirect resources from both sectors into this. That's a, I think, good example. I think we need more of this. And the pandemic partly has shown some innovative ideas how public-private partnerships can work very well and get us in a very speedy way to results. Another specific example of how also the industry in that regard, obviously our focus is developing innovation, and we need an innovation-friendly climate and the right priorities in the public sector as well, and another way to be a good brother or sister. You said that the North should be, we heard family, should be good brothers and sisters to the South. It's a differentiated patent right and licensing system. We do not file patents or reinforce our rights sub-Saharan. Other companies also follow that way. I think that's a good way in increasing access and making it easier for innovations to reach really the patients across the world. That is one or two specific examples, but yeah, seeing the interconnections, looking for the shared positive intent on the public and the private sector, and combining the capabilities, the skills, the power of those two sectors, I think that should be done more. And again, the pandemic and also the AMR fund are good examples that this can work.
Marcus, may I have another question for you?
Please.
Because it just came up into my mind, also related to the other ones, because you also speak about PPPs and the role of, say, industry and global corporate business. So, of course, you could say, if I would propose, say, so certain going to the what also Esther has said, this Robin Hood tax, or
I like the idea, obviously. The Robin Hood tax is
so going to the coffers of the king, and of course, in a way, industry is a king as a player, as a global player. But wouldn't you see, say, some kind of obstacles so that industry would be against any, say, minimal tax of any kind, or is it too bold? What is your impression?
The minimal tax was on flight fares, right?
Yeah, the minimal tax was on. No, it's on.
We would certainly support this.
No, it's on flight. Now you can, of course, enlarge it a bit. It's on flight. You can also do it on ships. tourism. I have been at the G20 Inception Conference, in the Japanese one, so they also favored this minimal taxes on certain issues. Telecom, so digital or financial services, or so Tobin tax, something like that. Would see this as a major obstacle, or if it is being done in a minimalistic way, couldn't that be an additional source for Priya and Vera and
Look,
Lucia?
I'm certainly supportive of this Robin Hood tax, and I don't think in general that necessarily needs to be an obstacle, or that would be automatically something that industry would look at negatively. It needs to be done smartly. I think everybody agrees that we need an innovation-friendly environment, and there is smarter ways than, for instance, violating IP rights. I think we all agree, and again, the pandemic, the vaccination development has shown that if there is a functioning innovation-friendly environment that science can deliver, and there is obviously some incentive in doing so, that combined with a smart licensing approach and a distribution strategy across the world in a way that, as I mentioned, for instance, then I think we can have the best of both worlds.
No, okay, it's a good point. So first Priya, and I see a quick shot, please, and also for Esther, and then I want to give the word to Vera again because she was a latecomer. Priya, Esther, please.
I just wanted to jump in quickly because this is a topic that we've been thinking about very deeply at the Pandemic Fund, as well as we've only mobilized, it's a good amount, but we've only mobilized 2 billion so far in the first year, and what we need is, as I mentioned, 10 billion per year in additional financing from external sources. So I would say, I think innovation, these ideas are great, and they've been tried as well, in some cases with more success than others. But let's not forget, this will take time, and we don't have that time to waste. We need to make those investments in pandemic preparedness now. So, for the moment, I think we need to rely on the traditional sources of financing that we have as we explore innovative mechanisms, because all of these investments need to be sustained over time. And so for the outer years, I think there's a lot of potential for innovation. And, it's exciting to see that, there's talk about all these different kinds of taxes and levies. And I see strong potential, but that money is not going to come now. So let's not kind of say, look at the future. We have to focus on the present too. And maybe one other quick point, which is that I think we need to think about innovation in fundraising, but there's also innovative ways in which we can deploy those resources. Sure. We can make every dollar multiply, like we're doing at the Pandemic Fund. Every dollar of grant money that we're awarding through our first round has mobilized $6 additional on the ground from various sources, mostly other NDBs. But let's kind of think of innovation in fundraising and innovation in smart deployment of resources.
Esther, quick.
For climate change, we had a presentation on a 0.1% transactional tax that would raise over 100 billion just for you transacting. I mean, even in Kenya, when we do the mobile transactions, Kenya does a trade of about 12 billion Kenya shillings. That's about $10 million every day. So can you imagine if we had a small tax of 0.1%, that would give a lot of money. And we're saying that if we take 0.1% for the global north on their financial transactions, that will give the global south all the money it needs to sort out all the problems that we have. And actually, some of the problems that we have are because we lack resources, and the resources are because of climate change, whether it's water, whether it's food. So I think it's a case of us showing leadership. Showing leadership and making those bold decisions. And I think our president is going out after the Africa Climate Summit. We were very proud as Africans to come together. We had audience from all the Global North partners, and those with ears obviously heard. Now the question is whether they'll put whatever they heard into action.
Yeah, to make it heard. No, I was very impressed. A moderator shouldn't say that, but I was very impressed from that pledge. Vera, over to you. So I guess you also have a view on, finance, old and new finance system for SDGs and Global South. What's your takeaway?
So domestic resource mobilization is an important component of how we finance this. During the COVID pandemic, I was heading the ECA at the time. We got together with Afri-Exim Bank and Econet. And using African resources, we were able to raise $2.2 billion that provided the first set of vaccines for the continent, which were bought by our own resources. And I think it's very important, even as we talk about, the need for additional resources from our shareholders, that Africa also begins to use its own domestically mobilized. Because let's remember always that development is 75% domestic resource mobilization. It is local uses of resources from, the woman who spends 7 cents out of $1 on her healthcare. We need to make sure that that healthcare is provided in an effective, cost efficient way so that she doesn't have to spend $7, 7 cents on the dollar for 70 cents on the dollar for that. She can do better and not spend a lot of her income on healthcare. So I think the first thing is policy. Good policies deliver cheaper resources. They make the need for resources a lot less. They also crowd in the private sector. In the report that we delivered to the G20, we are asking for a tripling. It's a triple agenda report. So we're saying, triple IDA, go from 30 billion to 90 billion. We're asking to triple global development resources. For all the conversations we're having, all the multilateral development banks put together are only $130 billion. We're recommending that it go to $390 billion and then leverage the private sector to get to $1 trillion. But the public sector, domestic resource mobilization, will deliver the other 2 trillion. So it's 2 trillion from the DRM, 1 trillion from external financing and the private sector. That's how you sort of split the financing needs. Now, taxes are good, but you need sort of global parliaments to agree. And precisely the topic of this conversation today, the global commons, we do not yet have a global commons institution that regulates this process. And so, at least on the climate side, we're talking about carbon pricing and the need to put the right and just price to carbon. And we believe that if we can put the right price to carbon, then governments can tax that. But it's one thing for governments to tax, it's one thing for governments to use those resources efficiently. It's another thing for Priya and the team to come in and bring the resources and the knowledge that is needed to make sure then that, you can prepare. So I think it's an all of, again, I go back to this all of systems. Yes, we need the multilateral development institutions. We need those concessional resources. It's much faster to get them through a carbon price. Tomorrow we can put a carbon price to everything and begin to work on it. For that, you don't need a global commons. You just need the integrity team to sort of say, these are the rules around which the market can play, and then the market will start playing. It is true that the maritime sector agreed that there may be a tax on the maritime sector where the resources can go into the global commons, but even that has not been agreed. We must always realize that when we say that we want to set up a new institution, we take the Pandemic Preparedness Fund, for example. It takes a while to set it up. It takes a while to agree on the governance. It takes a while to agree on the implementation. But as Priya said, this is an urgent, our report is called The World is on Fire. If the world is on fire, we don't have 4 years to figure out how to fix it, right? We need to start fixing it yesterday. And so my sense is, shareholders need to put resources into the existing institutions. We need, as nationals, to make sure that our leaders use those resources efficiently, effectively, that the policy stance of these countries is clear. We know that if your policy stance is clear, if the investment environment is stable, the private sector comes, cost of borrowing goes down. So I think there is a set of tools that we already know how to use. The question is, how can you use them at scale with speed and ensure that you're actually getting the impact that you need to go forward? So this is really, I think the question is, use the institutions that are there now as we build this sort of new financial architecture that hopefully becomes what polices the global commons, make sure that the taxes then go into the right places when we can raise them and put them into. But even on the tax side, OECD just came out with a new reform on taxes, which did not really involve and include the rest of the developing and emerging market economies. And so that has skidded a little bit. We need that when we start putting in place these rules, first and foremost, that the emerging market economies, the frontier economies, do have a voice on the table and have a say in the design of these processes and policies. Otherwise, then, we have, again, a delay in the process in an environment where we cannot afford any more delays to resolve the problem.
Thank you very much, Vera. So I think we are clear. This panel is clearly ready to save the world and the global commons. That's great. I think if we just could be doing 50% of what we just discussed, it would be a big step forward. So we can only work maybe together once in a while in a different environment. Let's see. So I'm very happy to have this openness, to have this frankness, and also to touch on sensible issues. And I think every part of society has to swallow something, and it will not be going away without nobody is hurt. Yeah? So, and I think especially, say, the main responsibility is in the global north to be very clear about that. And I think this must be the front runners. And this is why I was so impressed from your president's speech to say we can do it on our own, but you, of course, have to do it. And this is so that we not point with the finger from the east to the west and to the north to the south, but that we really try to see this as a global common good. So we're approaching the end, but I would offer each of you, say, one wish for the World Health Summit here in Berlin the next days. Would you like to start, Marcus?
Oh.
One wish.
One wish, yeah. I think we discussed that health is probably the most fundamental value for all of us. And we also, I think, agreed that we must not look at it in isolation, because the issues are interconnected, and so our solutions need to be interconnected. And for us at GHI, like the increase of global health, of quality of life in a sustainable way is a priority. It's our mission. And I hope that this summit here actually really brings people together, the smartest people who foster a climate of innovation in financing, but also in developing new solutions, and these interconnected solutions that the health priority needs are fostered here, and we get, when we leave tomorrow or on Tuesday, we are one step further in really defining our shared objectives.
So we just go along the row. Priya, your sentence. Three. You also get three, because Marcus took more.
A strong commitment to sustain financing for pandemic prevention and preparedness.
Esther.
I think we've got such serious mental health issues emanating from the pandemic, emanating from climate change challenges. So I'd like to see a lot more resources going into there. And now, of course, all the wars that we have from Ukraine to Gaza to DRC, Haiti, all the Somalia, I think that we should not forget to look at how are we going to ensure that health and health interventions are sustained in war-torn areas for the people that are there. Remember, we are all for the SDGs, and it says leave no one behind. So let's not leave anyone behind when we're talking about health.
Luciana.
I think a strong commitment with dialogue, effective dialogue, because we're in a divided world where our leaders are not dialoguing correctly. I think they need to dialogue, and we have a responsibility of putting them together and putting them in thinking of health and climate change and One Health as really important. We have seen in the pandemics that when we get together, we get better responses. But since the pandemic has going less in our minds and in our daily life, we forgot everything about it. Not everything, I hope so. We're getting weaker in our links. So we need better and stronger links between the world.
Vera, you also have a chance for final words. So, Vera, I guess we have.
Can you hear me?
Yeah.
The host just muted me, but I will unmute myself. The host agrees. No, it was very clear. I was just saying health for all must be placed at the center of everything we do. And we are fortunate today to have, I think, the benefit of digitization, which is going so fast. And so we can do a lot more with a lot less resources if we just came together and put a governance system in place that made it work for everybody. And so health, a governance system for health and for society in general, for financing that works for all, will deliver health for all.
Thank you, Vera, and thanks to all of you. So I think there could be a big applause, I think, for this panel, and it's... Thanks to you all, thanks to the technique. They solved a lot of problems, big problem solvers. We have to do our job now. Thanks a lot. It's